Music has so many healing components related to it. It can help us redirect our energy. It can help us be more effective in our communication. It can even help us be able to move through very challenging situations. Now, we just played just a few seconds of Jazz Essentials. It's available right here as an app on Zoom. We want you to think about adding music to part of your teaching strategy that you're using in the classroom. We were just at a conference, actually, it was Patricia Benner's inaugural conference in Las Vegas. And one of the presenters did exactly that. She played music and we got up and we danced to the music. Some of you may have been there. And I'm seeing more and more conferences really leverage the value of music. I shared in our last snapshot that I remember being in the PhD program and having a faculty member that played music every single night. And it definitely changed the energy. And it also allowed us to redirect our energy in a way that was different than other icebreaker type of activities. So I encourage you to consider using the music as a method to help move students through very challenging situations, or maybe to help you move through a challenging situation. We're going to continue our series and looking at those 12 biggest mistakes that new nurse educators make in their first year and beyond. Okay, so this is not just for the new nurse educators, it's for all of us to explore how we can become a better nurse educator in the classroom. Just as we normally do, you're going to pull out your resources, right? We have the seventh edition of Billings and Halstead, or you may have the sixth edition. We're going to talk, first of all, about resources that are going to help you close your knowledge gaps and become a better nurse educator. So, first, let's take a look at Billings and Halstead. Okay, so you're going to also, second of all, print out your study worksheet, okay, as we are looking in Billings and Halstead for a few resources to help guide you as you think about what your next steps are going to be after this snapshot. So that's what you're going to do. Write on your study worksheet today's date and an objective that you have in order to help you become a better nurse educator. All right, so we're going to focus on chapter 20 today. Well, let's focus on two of them. All right, so chapter 20 and chapter 21, because we just got this question. This is all centered all around the connected classroom. All right, so when you think about the connected classroom, what comes to mind for you? All right, and then I want you to take a look specifically at table 21.2 in chapter 21. Our ability to connect our learners with content and to be able to accomplish those learning objectives is really what we're focusing on when we think about the connected classroom. All right, and then on page 399, again, this is the sixth edition. This is where you're going to see strategies that we should use to help students adapt to synchronous technologies. All right, so they've listed here as an example different type of teaching strategies that we can use for synchronous experiences. So one example that it mentions is panel discussion. So being able to facilitate the introduction of a wide range of informed opinions in an efficient manner and some adapted teaching strategies if we don't have the option for a panel discussion, or if we want to think about different ways we can utilize the panel discussion. These are some options. So learners should be prepared by previous assigned learning activities. We want to keep presentations short so all panel members have sufficient time to present the information. Panel members can be geographically dispensed and live or online. Okay, so that's some flexibility that you could incorporate. If you don't have all of your panel members, or if you're not able to have a panel discussion, what you can do live, that is, what you can do is you can record the panelists and you can create a discussion post for those students that are asynchronous. So if they are remote, if they're all across the country, which I know if you're like me, some of my students are when I teach online, that's a way for you to be able to adapt this wonderful traditional synchronous strategy and translate it into an asynchronous strategy, but still receive really good benefits from a panel discussion. Moderator summaries are crucial. Okay, I want to highlight this because this is how we're going to close the loop or tie all of the elements together regarding that panel discussion. How many of you have facilitated a panel? All right, so if you have your hand raised, you can, I'm sure, relate to the challenges associated with facilitating a panel. Okay, and then you're going to use chapter 20 just to go through some of these important elements. Starting on page 376, gives you a great description of the connected classroom. It talks about how we establish a brave space for our students, making sure that we check on technology and seeing if internet is available. And I would add not only for you as the faculty member, but also for the students, making sure they have access to the resources they need in order to effectively learn what we have identified for our teaching plan for that class. All right, so we're going to flip over and take a look at our thought-provoking question first and foremost. All right, so let me flip this around. So the thought-provoking question we're going to look at is related to number 5 as soon as I close this Prezi window. All right, so when we look at question number 5 or challenge number 5, we know that it was all around effective communication, right? So that's what we talked about during our last snapshot. Well, now what we're going to do is we're going to take a look at what those next steps are going to be as you move forward and looking at how do you close your knowledge gaps as it relates to the ability to engage with your learners in a classroom in a meaningful way. All right, so let me see if I can turn this around. Didn't we just talk about technology, right? Isn't that funny that now all of a sudden my technology stopped working properly? All right, so I'm gonna close that app. There we go. Amazing what happens when our technology behaves. All right, so here we go. We're gonna take a look at the thought-provoking question and then we're gonna transition to our content. And this is all around helping you move through those 12 challenging situations. We, in this snapshot, are going to cover number 6. But like I said, number 5 was all around what do we do or how do we handle ineffective communication or communication breakdowns. All right, so we have Professor Jamie, who has been teaching for 5 years but has never attended a professional development conference or pursued additional certifications. What would be the most beneficial next step for Professor Jamie's growth? Now, what you think about, what is this question really asking me? Okay, let's go back. Before we even look at the options, what is this question really asking me? And what is it that I know for sure about content related to this question? All right, so A, focus on content updates in the fields of nursing and healthcare. B, enroll in a certification prep course and attend an education-focused conference. Or C, ask clinical colleagues to recommend conferences to attend. All right, so I'll give you all a second to take a look at the question. And when you're writing down on your study worksheet or on your piece of paper, I want you to make sure you're thinking about any content that I mentioned that is foreign to you. Okay, so as an example, I talked earlier about the connected classroom. You now have page numbers to help you close your knowledge gaps related to that area. If you have the 7th edition of Billings and Halstead, the crosswalk is right here in the description. But if that's a muddy point for you, as I was talking through technology and how we work with our students, how we partner to connect the classroom in a way that closes the loop. So they walk out of the classroom with clarification, right, about concepts that we've discussed. And the goal is that we're able to clarify any muddy points that they have. And if we're not, we just want to write it down as a note, right, for ourselves. If we get that deer in headlights look, if students seem kind of zone out after we have reviewed our content, we can always go back and think about what concept do we want to add to our next discussion, or what content review do we want to cover? Or maybe there's a recorded video that you want to share with the students to help them clarify muddy points or close their knowledge gaps. All right, very good. So hopefully you had a chance to write your answer down. Now we're going to go back to our presentation. And when you think about the thought-provoking question, remember that we don't write questions for NLN, so that's the good news. And we don't want you to be too hard on yourself, okay? Remember that these are exactly that. They are thought-provoking questions. You won't see these questions on the exam. And so we want you to be able to think about the rationale for the incorrect answer and the correct answer. All right, so we are looking at what happens when we neglect professional development. Well, we are creating a toolkit for ourselves in order to be able to work through those challenging situations, as we mentioned earlier, looking at the mistake number 5 and the challenge number 5 was really around the effective communication, the value of effective communication that we bring into the learning experience. Well, when we neglect professional development, we know there are some negative consequences that we will talk through. And our ability to really kind of channel that energy in a way that allows students to still have a great learning experience is definitely a skill that we have to develop over time. Okay, so next we want to take a look at our content that we're going to take a deeper dive into exploring some of these key elements to help you either achieve success on the CNE exam, or maybe you are here because you want to be a better nurse educator. Or maybe you're on a journey to become a nurse. That would be great too. We know that we're not only teaching future nurses, but we're also teaching future nurse educators and future nurse leaders. So, what happens when we neglect professional development? Consequences and impact. First of all, ignoring professional development today leads to consequences, negative consequences later, right? We can feel frustrated. We can feel like we don't have the tools that we need to be successful. It's focusing on improvement strategies. How do we get better? That continuous quality improvement and engaging in the commitment to lifelong learning, just as Malcolm Knowles discusses in his work. You can easily access this ebook that we are unfolding week to week that's going to walk you through some tips, not just what those mistakes are, but also some strategies to help you move through them. You can also scan this QR code and it will take you directly to this resource. 40%, that is one of the report's data that they explored how retention is affected, how turnover is affected when there is not professional development, when there is not a consistent investment into how employees grow. Okay, what do? They leave because they feel like they are not getting the support that they need. So it can lead to up to 40% of the turnover that we see in all industries. Okay, so this isn't just nursing, it's all industries. Our ability to retain our faculty and our nurses and any talent pool that we have is critical to our success, especially in academia, but also in healthcare, not just in nursing, but in healthcare overall, because we need each other to be able to provide quality patient care for our patients. Amateurs practice until they get it right. Professionals practice until they can't get it wrong. Okay, so again, our ability to engage in the advancement of professional development, of our expertise in a way that achieves competency in the classroom and equips students with the resources and the support and the guidance that they need to do a good job in the clinical setting starts with us, right? So we have to, first of all, identify what are my gaps. Okay, so I want you to write this down. What are your gaps right now as it relates to effective facilitation of learning, being that effective coach? So, what is one gap right now that you feel like you've identified? Okay. And then the second step I want you to take, I want you to write down when are you going to address that gap that you have in your practice? And third step is, okay, I added one. Third step, I want you to write down when are you going to close that gap? Our ability to write down and be accountable for the opportunities that we have can lead to up to 70% of our success. Okay, so I want you to write down what is that gap, number one. Number two, what is it that you need to close that gap? Okay, so what would be next steps? And then third of all, when are you going to make that happen? When are you going to close that gap? Here's the good news. You don't have to share it with us. You don't have to put it in the comments. We want you to have some increased accountability to yourself, okay? And you can certainly share it with a colleague and with your leader to increase your accountability even more. All right, so as we wrap up our last few slides together, I want to talk more about what your next steps are going to be as you think about moving forward on your journey towards nurse educator excellence. Mentoring. You all knew that we had to talk about this topic because it is so essential in nursing education. There continues to be questions on the exam related to mentoring, related to role socialization, related to professional development. Now, we know role socialization is important in nursing programs, right? We want to help the student, that nursing student, become more socialized to the academic requirements of a nursing program, right? We know there's high rigor in a nursing program. And we want them to be socialized to the professional norms of nursing, such as interprofessional collaboration, right? We have to be able to communicate effectively with team members, with our colleagues in the clinical space so that we can deliver the best care possible. Well, for us, we want to have a better understanding of what are those specific behaviors that help us become a better nurse educator. That's why you're here, right? You want to learn what are the steps that you should take to help you avoid making those mistakes, or when those mistakes happen, what are we going to do to help move through them to create learning experiences, right? To create those teachable moments for ourselves and process that information that will help us become a better nurse educator. And as much as we can to mitigate and to avoid making those mistakes, ideally is the goal. How can we do that? Mentoring. So making sure that we have a mentor that's going to help guide us to give us feedback along the way. And for some of you all, you may serve as mentors yourself, right? So we have the mentee need, and we also have the mentor need. If you are at a point in your nurse educator career where you're able to mentor others, that's a wonderful opportunity for you to reach out to a younger faculty member. They can be, 1 to 2 years, or maybe they're 5 years, and you see there's an opportunity where you can help them close that knowledge gap and build up their skills, right? We want to be able to help each other through any challenges that we have related to our development. What else do we know about professional development? Well, we want to look at trends over time. As an example, you all hopefully have written down an opportunity that is a gap for you. Well, over time, what you want to do is take some time to do reflection and identify, okay, so where was I related to this specific content area or concept a year ago, 2 years ago? How have you grown related to that specific area? What you will find is early development is key. When we focus on those core skills, this is why we're talking about the 12 biggest mistakes. We're developing a foundation for a very long nurse educator career. Modern practices, how can we incorporate technology? Are we leveraging all the benefits of technology? There's so much access to information. Sometimes we don't know what information we should use and what we should purge, right? So think about the selections that you're making for your professional development with webinars, with conferences, because we want to make sure that it's helping you grow as you move forward on your career. We're engaged in this cycle of continuous learning. All right, so who can put in the chat or write on your paper, lifelong learning, commitment to lifelong learning, being self-directed in what we are learning, and also identifying our knowledge gaps. Which specific theorist is this work most closely and strongly associated with? All right, and then future trends. What is our priority today? May be different than our priority in 5 years from now. Okay, but we know some standards are going to be there in our nursing curriculum, right? It's just the foundation of nursing, such as health assessment, okay, such as fundamentals. We know those topics are going to be foundational for our nursing students, but here's the caveat. How are we facilitating, really coaching students to help them comprehend those concepts in a way that allows them to advance their knowledge, their thinking skills in a way that they are making safe patient care decisions, and ultimately being proactive in preventing patient harm, seeing those early signs, seeing those cues, and determining what their next step should be. How are we really facilitating the knowledge that students need to be able to process and ultimately demonstrate in a safe way? All right, so that's really the trends that change, is looking at not necessarily what we teach, but how we teach, how we coach, how we facilitate the learning process. All right, so if you wrote down Malcolm Knowles as being the pioneer, one of the important theorists that you need to make sure you have a good understanding about, you are correct. So Malcolm Knowles' adult learning theory is the theorist that really talked about being self-directed in our learning and the role of self-actualization. There are actually phases of self-actualization in order for us to engage in mastery of that self-directed, that lifelong learning commitment. The art of mastery, a key element when we talk about professional development, self-reflection, being self-directed, identifying what our learning needs are, really is honing in on what is the art of mastery. Well, let's talk about what it's not. It's not about perfection. When we are faced with a challenge, when we maybe second guess ourselves about what our next steps are going to be, or perhaps we can make a decision and we decide, you know what, that probably wasn't the best decision. That's a learning opportunity, right? It's not a mistake necessarily. It's a learning opportunity. We want to be able to engage in these habits of practice that allow us to consistently achieve competency, right? So this is when we look at that psychomotor learning domain, this is that highest level of naturalization. It's just natural because we're so accustomed to being in front of our students. We know our students so well that we're able to connect with them in a way that allows them to achieve competency as well. We can explain those terms and they're able to apply them. They're able to answer those difficult questions. And we can validate that students have this knowledge that they have actually learned the concepts that we have identified. So that's the art of mastery that we want you to think about. So what's your number? We've talked about Billings and Halstead resources that are going to help you. We've talked about what your next steps are going to be. We've shared some tips, some strategies to help you work through the professional development need that you may have, and perhaps there isn't funding for you to attend a conference or to go to or complete an exam prep class. We want you to leverage, though, all of the great resources that you do have accessible to you through usually at your college, at your university. And if you're a member of a professional organization, there's usually resources there as well. So what's your number based on these concepts that we've talked about? And you're going to make sure as you're looking through your blueprint, if you're on the renewal journey or if you're on the C&E journey, making sure you're looking at the detailed test blueprint that's included in the workbook. Okay, so if you go to the nln.org website under NLN certification, you're going to see a study workbook. Okay, and that is, or a candidate handbook, I should say, candidate handbook for each of the exams. And this is going to help you ensure that you're aligning your study plan and your specific activities for your renewal credits with the actual competencies. Okay, so that's really important. So how are you feeling right now? 1, are you feeling lost? Or 5, you're ready to teach? Go ahead and write that on your sheet. Feel free to put it in the comment section. We go back and look at our comments as well. All right, so now what we're going to do is we're going to finish our time together by taking a look at our thought-provoking question. All right, so hopefully everybody has had a chance to write down the thought-provoking question, the answer you think is correct, before we reveal the correct answer. All right, and we're going to talk about the rationale as well, so stay with us. All right, so here we go. First, we need to adjust this one. Let's see. And we're going to finish out with some music too. So if you need to debrief, which we all should do, you will have a chance to do that. All right, so what's your answer? If you chose B, give yourself a round of applause. All right, so B is the correct answer. Enroll in a certification prep course and attend an education-focused conference. Professional development tailored to teaching can expand both content expertise and pedagogy. You know, that's one thing that we talk about here at Dr. Sellars Educate. We're excited when you pass the exam. We like to track our rate. We're still at 98 to 100% when following our 7-week study plan. That's key. Just like with NCLEX, once you go outside that 7 weeks, you're less likely to be successful on the exam. Okay, so after you finish our masterclass, whether that's live or self-paced, we want you to take that exam within 7 weeks. Okay, so if you follow our 7-week study plan, you know 2 weeks after you finish the course, you should be taking the C&E exam because you are ready. You've closed your gaps because we've already developed content that's going to help you master the concepts that you're focusing on for the C&E exams. Okay, so this is what else we want you to consider. If you're not at a point where you can engage in a conference or a prep course, use the resources you have, like this channel with the content that we share. It's going to help you close your knowledge gaps because it's not only about passing the C&E exam, that's priority, but the second step we want you to take is we want you to actually integrate these evidence-based strategies that we're talking about, okay? So let's go back so I can make sure you understand the rationale for the incorrect options as well. So A is incorrect because content updates are not sufficient for pedagogical growth, right? And then A, it's nice to ask our colleagues to recommend conferences. It's not that that's not a good thing to do. It is a good thing to do. However, clinical colleagues conferences may be a different focus than what you need, right? Because you've been teaching in the classroom for 5 years. And when you go to conferences, it's just like any other webinar that you go to. There's going to be value that you walk away with, hopefully, because you vetted the conference and you want to implement, right? You want to execute, you want to act on some of those takeaways that you've gathered from the conference. We hope that this snapshot has been helpful for you. Remember to write down and take some time to reflect as we play some music before we leave. This is going to help you, hopefully, not only close your knowledge gaps, but also help you become a better nurse educator. All right, so we look forward to seeing you in our next snapshot. Thanks for joining, everybody. Have a great one.